And an annual checkup with our OBGYN is not something we look forward to, but it is so important. Still, we tend to sometimes skip them, delay them, or some don't go at all. Dr. Anna Melnikoff from Ascension St. Vincent joins us this morning to talk about the importance of that and some changes that may put some of you at ease. Dr. Melnikoff, good morning.
Hi, good morning, Janice. Thanks for having me.
You know, it is so important to have your yearly visit to your OBGYN, but a lot of people do put them off. What is the danger of that?
Absolutely. We really encourage that annual visit, and you're exactly right. I know a lot of women really dread it. I know that pelvic exam is not at the top of your list for things to do for the year. But we do it. The most important thing is for preventative care. There's a lot of things that we just can't necessarily see or feel. And so it's important to come in for your doctor to have a really good, thorough breast and pelvic exam with your annual visit every year. And the danger is just that we can miss things. And so that's why we really encourage, even though you don't want to, I know it's not fun. I joke with patients, I don't want to see my doctor any more than they want to come see me sometimes for that pelvic exam. But go ahead and make your appointment. It's good to go ahead and come on in.
Part of that yearly visit includes a pap smear, and that is checking for something like cervical cancer, correct?
That's exactly right. So the pap smear screens for cervical cancer, which is particularly important this month in January. So January is Cervical Cancer Awareness Month. And so it's a great time for us to think about, I encourage patients, you know, it's the start of a new year. Think back to your last pap smear, think back to your last annual exam, and are you up to date? You know, the pap smear screening has changed in the last 10 years. It may not be necessary for you to get a pap smear every year. Sometimes we're able to space that out to every 3 or 5 years even. But that depends on your age and your history. So have a conversation with your doctor if you're due for your pap smear this year. But regardless, if we don't do a pap smear, we still recommend a good thorough pelvic exam. So still got to come in for that annual.
So even though you may not be doing the pap smear, the yearly appointment is still important, and your doctor would tell you whether you fall into the category of a yearly pap smear or not.
That's exactly right. Okay. And even though we may not do a pap smear, we can still see things on the pelvic exam. And so it's still important to get checked.
All right, the other ovarian cancer, we all know, sadly, I know work is being done certainly all the time to try to find a test for that, but to this date, there's still not one, is there?
You're exactly right. There is no screening for ovarian cancer. You know, we have screening for breast cancer with mammograms. We have screening for cervical cancer with pap smears, but we don't have a screening for ovarian cancer, but we really wish we did. And thinking about ovarian cancer, obviously for patients, if they have any family history of ovarian cancer, they need to let their doctors know. But I also tell women to listen to their bodies. You know, there are some early signs and symptoms of ovarian cancer. And so I would really encourage women, if they're not feeling well, if something feels different to them, I tell women they know their bodies the best. So talk to your doctor and don't let those symptoms go, ignoring them.
How old should a young girl start coming to see an OBGYN?
That's a really great question. We get that question a lot from parents. You know, it's different for every young girl. And so I would really encourage parents to individualize that to their daughter. But we generally recommend around 13 or 14 is reasonable. But for some girls, that may be a little bit later, as late as 17, 18 or later. But importantly, we don't start pap smears until age 21, and that's regardless of sexual activity. So I always tell parents, you know, young patients are scared to come in. They're scared they're going to have an exam. But a lot of times we just talk and we discuss, you know, contraception. We discuss healthy menstrual cycles. We discuss healthy relationships, mental health, and mostly just to get them familiarized with coming to the doctor and meeting a physician, just so they kind of get in the routine of participating in healthcare. And so I would encourage parents to think, once we kind of get into middle school and especially high school, talk with your child and consider coming to visit the OBGYN.
For someone watching as we wrap up who may put off that appointment just because they don't want to, or we do get embarrassed if we skip an appointment for a year or two. We feel bad going back to our doctor because we feel like we're going to get shamed, but we shouldn't. And I know Absolutely. I feel better when I go back if I've skipped one. So tell anybody watching right now what they should do.
Absolutely. We've had a lot of patients who have skipped appointments or missed appointments or put them off, especially during the COVID pandemic. And that's okay. It's never too late to come in and see the doctor. We're not judging. We're just happy you're here. So go ahead and come on in. If you haven't made your appointment for the year, or if you feel like your pap smear may be out of date, be sure and check and go ahead and schedule an appointment with your doctor. It's better to go ahead and come on in.
Dr. Anna Melnikoff, thank you so much. We really appreciate it.
Thanks for having me. Y'all have a good morning.
You as well. Now here's Jay.